Welcome back to Weekend Prime. Let's now talk matters health. And sexually transmitted infections are blighting Kenya's teens, according to a study by the Kenya Medical Research Institute, KEMRI. Sexually active adolescents from the lakeside city of Kisumu are said to be likely to have chlamydia or gonorrhea or both. This, according to a study on the prevalence of both diseases among Kenyan adolescents. On this episode of Health Digest, Gloria Milimo interrogates why experts warn that the war against STIs, especially among the demographic, cannot be won if STIs remain steeped in stigma. Take a look.
A silent epidemic is slowly ravaging the lakeside city of Kisumu. A public health threat that has left the city's most vulnerable, exposed, and grappling with the burden of sexually transmitted infections. At the center of this worrying trend are adolescent boys and girls from the sprawling slums of Ubunga, Manyata, Bandani, and Nyalenda, whose riot of hormones has resulted in an STI prevalence of 9.6%, with girls said to be twice more likely than boys to test positive for sexually transmitted infections. Kevin Kadede, a researcher from the Kenya Medical Research Institute, KEMRI, explains that of the 111 adolescents who tested positive from the study dubbed prevalence of chlamydia and gonorrhea among Kenyan adolescents, 96 had chlamydia, 9 gonorrhea, 6 had both chlamydia and gonorrhea, as 73 among them reported never experiencing any STI symptoms.
One of the reasons behind targeting the formal supplements is the high risk levels in those supplements compared to other settings. And two, because of the limited data in terms of HIV and STI prevalence among adolescents, especially within such kind of settings.
The researchers tested urine specimens from at least 1,200 adolescents between the age of 15 and 19 years. Nearly 10% of them were diagnosed with chlamydia or gonorrhea. Two-thirds of this demographic with a positive STI test, according to the study, reported not having experienced any symptoms. And this, according to the researchers, might have been missed by syndromic management.
The rationale behind the syndromic screening is a cost factor, because the molecular tests are not that cheap. So and the adolescents and young people majorly may not be able to access to afford the cost of that.
Sexually transmitted infections remain prevalent and are increasing in several populations. Despite the need for appropriate diagnosis, which doctors say is crucial to prevent the transmission of untreated infection, most diagnoses in Kenya, according to the Institute, are based on the identification of characteristic symptoms without laboratory testing.
We have quite a high portion of asymptomatic, thereby undiagnosed STIs among adolescents. A good portion of the adolescents who never expressed any symptoms, two-thirds actually turned out to be positive, either gonorrhea, chlamydia, or both.
Chlamydia is a preventable and curable sexually transmitted infection caused by a bacterium which can be transmitted through vaginal, oral, or anal sex. The World Health Organization estimates that at least 120 million chlamydia infections were recorded among people between the age of 15 and 49 years in 2020 globally. Its symptoms include burning sensation when urinating, discharge from the private parts, pain or discomfort in the lower abdomen, and pain in the testes, among other symptoms. Gonorrhea, which is also caused by a bacterium, presents with similar symptoms. In 2020, an estimated 82 million new infections were recorded among the same demographic. Both diseases are treatable. However, untreated STIs, like the two, can result in onward transmission and can significantly impact the reproductive health of the patient.
Undiagnosed STI can lead to infertility in future, can lead to pelvic inflammatory diseases that can also lead to constant pelvic pain. And it also exposes them to higher risk of HIV.
The research has now put to fore the unmet need for sexual education among this demographic. It corroborates what reproductive health experts warn could hamper the fight against STI, especially among this demographic.
Adolescent sexuality is viewed as something that should not be happening. And it also shapes their decision-making, that they fear being known to be engaging in sex. Stigma really shapes the decision-making, and the dialogue needs to be there around understanding and embracing that adolescents are actually having sex, and then they need that guidance on how best to go about it.
To effectively curb STIs among adolescents, experts also call for a multi-sectoral approach that focuses on prevention, education, and access to care, among other approaches geared towards stemming the spread of the disease.
The discussion around adolescent reproductive health needs to be expanded at all levels, starting from schools, and more importantly, at community level. Because schools, yes, they'll be among their peers, they will talk freely, but then when they come to the community where we as parents are, we look at this discussion as a taboo topic still. And the stigma that we the stigma that comes out of that is what ends up to making these adolescents sort of shy away from talking to us.
Gloria Milimu, KTN.